look at a couple of diseases related to the musculoskeletal system. This certainly is not a look at every disease that are out there, but I picked a few big ones so that you can get an idea of how medical terminology helps you to understand musculoskeletal diseases. All right, osteopenia. Osteopenia. If you want to see the official word breakdown, just watch our previous video. We break it down together, so make sure you go back if you need to. However, it did break down to the terms deficiency of a bone. What's starting to happen is that the calcium inside your bones is starting to reduce. We call that a decreased bone mineral density, and the abbreviation for that is BMD. Hopefully you know that calcium makes strong bones. And so, here we've got somebody creating a healthy diet. So calcium is not just found in things like milk and cheese, but you can also find it in some vegetables, particularly places like spinach. However, you do find large amounts in dairy products. We need that calcium to go onto our bones. And if we don't get enough calcium to make our bones nice and strong, it's going to result in osteopenia where the bones become weaker. All right, if the bones get weak enough, osteopenia will develop into osteoporosis. And that poro portion, P-O-R-O, referred to having holes. And so you should kind of have this pretty thick, very dense picture here on the left. You do have some holes in your bones. If your bones were 100% solid mass, they would be too heavy to lift. So they do have some holes in it. This middle picture is sort of showing you that those holes have become too large in size. And the picture here on the right, they're almost so large in size that we don't even really have any holes and there's not much structure left. And so what you'd really like is this picture on the left here, where you've got some solid bone mass and the holes remain relatively small. What you don't want is the picture on the right with osteoporosis, where that lack of calcium really has led to this decrease in the bone mass, this bone density. And when you don't have enough calcium sitting there, what's going to happen is they become very weak and they're going to start to fracture or to break. And so we don't want us to do that. So certainly make sure that you are getting enough calcium, take supplementation as needed, and certainly even getting up on your bones, walking around helps to promote stronger bone growth. Next up, we have a pretty common one. This one is osteoarthritis. Okay, remember arthritis was inflammation of a joint, and that root term osteo just refers to a bone. Osteoarthritis is what I just like to call, arthritis of older age. You have used your bones a lot. They do become a little bit worn. Sometimes, they can start to rub against each other and to create some additional pain and some inflammation. So the more you use your joints, okay, the more likely they are to become inflamed. So osteoarthritis is really just when you're getting inflammation of the bones and the joints. And this is most common as we age because we place so much pressure on those joints. We do have another type of arthritis, and there's certainly more than these couple that we're going to talk about, but rheumatoid arthritis is another common one. This one is a little bit different, despite the fact that you see that term arthritis, okay, which does mean inflammation of the joints. Rheumato, if you remember, meant that watery flow. And so in between each of our joints, we have a little bit of fluid that is normal, and that just really helps the two bones from rubbing together and creating this excess inflammation. Some of what happens as we get older is just that we've had a longer time to wear and tear, to break that down, and to reduce that fluid or to create some damage to the bones. With rheumatoid arthritis, what happens is your immune system starts to attack that fluid in between your joints. So it kind of recognizes you as not being you and actively attacks, okay, that fluid. Well, that fluid was there to help those two bones to, prevent them from rubbing together. And so we don't want to attack that fluid. It creates a lot of inflammation, a lot of pain, and a lot of bone destruction in those areas. It's just a different cause. right? Where osteoarthritis is a little bit more wear and tear, and taking care of your joints will help here. Rheumatoid arthritis is caused by your immune system just randomly attacking your joints. All right, next up is a strain. You've probably had this one before. Most of us have. You've gone out, you've done a little bit more activity, gone to the gym, maybe played a little bit too much on this weekend, and you wake up the next day and your muscles are a little bit sore. So, what happens with a strain is that the tendon that's attached to that muscle and helping hold it onto the bone just creates some micro damage, right? If it was serious damage, you'd probably be in the emergency room. That would be awfully painful. But micro damage does happen. The good news is there's a lot of blood flow to your muscles and to those tendons. And so over the course of the next couple of days, if you just give it a little bit of rest, that strain is going to heal itself, and then just take a little bit easier on yourself. Or you could warm up a little bit before strenuous exercise or stretch before exercise. And this would help to minimize your strain after going to the gym or after doing anything that's really outdoors. A sprain is next, and a sprain is a little bit different than a strain, right? A strain was really associated with the muscle and the tendon that attaches to the bone. A sprain is really a stretching of the ligaments. And if you went back to your word list or you go back to one of our videos, a ligament is really just what holds two bones together. Okay, you have thousands of them between every bone that's next to each other inside your body. And they should hold pretty closely so that things don't just sort of move any which way, but that we keep all of our joints kind of in a closed space. However, when we sprain something, right here we've got an ankle, which is awfully common, right? You may have twisted and sort of stretched that ligament a little bit. And if it's a complete tear, you certainly want to go seek emergency treatment. You may need surgery for something like that. But the vast majority of sprains are just some micro damage. Now, the unfortunate thing is that between the ligaments, there's a little bit less blood flow. And so this one will take a little bit of time to sort of heal itself. So somewhere between 6 and 12 weeks, right, for a serious sprain. And it can be awfully painful, right, once you do that. Most of us have probably twisted an ankle and spent a few weeks with an ACE bandage on or on crutches. But you've really just stretched that ligament or done some micro tears to that ligament, which creates some problems and some significant pain.